Hey guys, welcome to another episode of the Being Rare podcast. It is a nice, chilly day here in North Alabama. Today we are talking about knowing your family history. My co-hosts today are two friends of mine, Jasmine Hightower, who has been on another Being Rare podcast episode, actually back just in September, and a new friend, Hana, who is some distance away, but we'll get into that in just a minute. Hey, ladies, welcome to the Being Rare podcast, and thank you for being my co-host today. Welcome.
Thank you for having me again. I can't wait to jump into the conversation.
Awesome. Jasmine.
Thank you for having me, new guests, and I'm excited to meet both of you, Jasmine and Sarita.
Thank you. And Jasmine, I know you are in Dothan. It is chilly and sunny here in North Alabama. What's the weather like there?
It is a little bit chilly. It's been chilly for a couple days. The wind has been blowing. It actually feels like fall. I don't think it's going to stay very long, but I'm enjoying the little chill.
Right. Me too. I actually traveled the past 3 days and it was really cold, not cold, but colder where I was versus now here back home. But we don't get excited too fast here in Alabama because the weather can change in a matter of minutes. Hannah, tell us
Exactly.
about Hannah, tell us about where you are and what the weather is like.
Right now I'm in Sweden. Luckily I'm South Sweden, so it's not like the complete snow and freezing that people imagine. But yeah, it's the temperatures decrease. We're going into winter and I'm not ready for it. So
Right.
pretty
So
chilly night right now.
Right. Does Sweden get a lot of snow
Where I
in the
am,
winter
not
months?
really. I'm really far south, like the southern tip. So not that much snow, but for a couple of weeks we do have snow that doesn't really stick to the ground, but it's still really beautiful and gets super festive over this time of year. So I'm excited.
Awesome. Well, I am so excited to have both of you on. And so, like I said, October is Know Your Family History Month. And we both, all of us, the three of us on, of course, separate occasions, have had really great conversations about, our family histories and how just over the course of our lives, we have found out information um, about other folks in our families, but specifically for both of you, your parents and grandparents, you were able to find out information based on things that you had been experienced or that you had experienced. And so I thought it just made sense to have you guys both on today's episode to just talk about that. And so let me start with you, Jasmine. During our newborn screening conversation, you talked about having sickle cell disease and how during the newborn screening process, that's when your parents found out they had the sickle cell trait. Tell us a little bit about that.
So, like I said before, my mom, she was a young teen mother, so she didn't know. And nobody in my family had ever had sickle cell before, and nobody had ever been told that they had the trait or anything. And that went also for my biological father's side, too. After I was diagnosed with it, um, luckily my mom and my family, they saw how I was doing with this disease, and they made it their mission to make sure that, I guess in a sense, everybody knows their status related to that. um, we have had, some people have had, like my mom, she had a study done, genetic study testing done, things that she might develop later on in life, things that she might develop from her dad or her mom or things like that. I have had similar tests done. And also for me, it also made where my family was, when they had a child, they were like, okay, I have a cousin that has this disease, has sickle cell. Can you test for that? because in the process, we have learned throughout the years that the sickle cell trait does run on my mother's mom's side of the family. And through that, I have my cousin, one of my cousins went to basic training and found out he had the sickle cell trait. From then, he also has a daughter that has sickle cell. Me and her are the only people that have sickle cell in our family, on this side of family. But also, we have found out cancer runs on our side of family too, different types of cancer. And on my biological father's side, cancer runs on that side of the family too. So I have to be extra careful in things that I put in my body, and I try to make sure that it's the healthiest thing that I can do. And that doesn't necessarily meaning natural. It could just be what is best for what my body needs for that time. If it's natural remedies, if it's medicine, whatever. But it has sort of helped along the lines of, we talk about um, our medical history, and right now with my grandmother and her siblings and some of her first cousins, they have all been diagnosed with glaucoma. So
Mhm.
it's like building, and we're realizing like, oh, it does run in the family. And yeah, I do have a lot of people with that. So with us talking about it and not being so taboo with what is going on in our lives and what's going on in our health, and making sure we're checking up on each other, it has really helped in a sense of learning about family history. Like, oh, you suffer from that too? I thought I was the only one.
Mhm.
And that really has helped in a sense.
Awesome. That's so amazing. It's so amazing that uncovering or finding your diagnosis. Um, as a newborn, our new baby, has this disease, and that's how we find out that we carry the trait. Like, it's just it really speaks volumes to the importance of having those conversations, but also the newborn screening process. Um, Hannah, I would love for you to chime in too. You and I, we talked briefly, and you had shared some experiences with your family, and how receiving diagnosis and uncovering diagnosis revealed some things for some of the elders in your family. I'd love for you to share a little bit of that.
Yeah, and Jasmine, thank you for sharing your story. I think that's really amazing that your family does communicate like that. I know I've spoken in my community, in my rare disease community, about communication all the time and how important it is. So my story is that my grandfather on my mother's side passed away from, uh, it was ruled as a heart attack, but it was kind of unknown his whole life what he was struggling with, and had seen multiple doctors and never came to any sort of diagnosis. But he had been in pain, he'd been diagnosed with too many different things, and no one could really give him a conclusion. So when he passed away, that's when my mom and her two sisters, they realized this has to be something else, and asked more questions, and figured out that they have a rare genetic condition called hereditary angioedema. And this causes recurring swelling attacks in the body, either internally or externally. And the triggers can be almost anything: stress, estrogen, certain foods, alcohol, physical activity, anything. So he'd been battling with something that he thought was a bunch of symptoms that were unrelated, but turns out they were actually all one condition. And only when he passed away, my mom and her twin sister found out that this is what they've been battling their whole lives too. And they were about 28 at the time, I think. And I know that receiving a diagnosis that late in life with this condition is quite serious, because it is fatal, it is life threatening. So they had had multiple, I mean, their whole life since they were born, they'd had these swelling attacks that were threatening their lives and constantly getting misdiagnosed about it. And we realized then that the reason it was so hard for my grandfather to get a diagnosis is because he was adopted and he doesn't have that side of his family history of his biological parents. So the misdiagnosis kind of came because without the information of your family history, the hereditary side of it is kind of lost and it's not easy to diagnose. That's kind of the key in diagnosing a lot of hereditary angioedema. So yeah, we speak about it all the time with my family, how important it was to communicate this and how much of a relief we got when they found out, because at the time my sister and I was 2 years old and my sister was about 4 years old, and she was already showing her first symptoms. So at the time that my mother and her twin got diagnosed, it was perfect timing to know, okay, both of my kids need to get tested. And sure enough, within 2 years, we were showing extreme acute swellings and attacks. And it was really a blessing that they figured this out before we got a bit older, because it made the world of difference just having the correct diagnosis. I hear stories from them not knowing, and it was terrifying. So I'm really grateful, and I'm grateful that I had um, the warning kind of by the time
Yeah,
I started going through these things. Yeah.
yeah,
So I think
yeah.
family history is super important to speak about it openly between extended family and your direct family.
Yeah, yeah. And I'm watching the clock, Jasmine. I know you have another appointment or something else that you have to step away and do. So you just, if we're in the middle of talking, and I know if you have to shut your camera off or whatever and leave, please do so and come back if you're able to. Um
Yes,
but
I
I
sure will.
Thank you, thank you. I did want to, just kind of stay in that conversation. About the importance of having those conversations, which is really great that both your families made the decision to talk about it, figure out what was going on, and then share it with other folks within the family. Once they started to figure out what was going on, so Hannah, for your family, once they started figuring out, what was going on, and Jasmine, for your family, when your mom and dad realized that they carried the sickle cell trait, I'm just curious, did it change the course of their healthcare, and how they receive care, how they approached care? Did any of that change in terms of now we know something that we didn't know before? Let me start with you, Hannah.
Yeah, I mean, for us, it was receiving the diagnosis or not, which was life changing. So um, I think as soon as my mom and her twin sister found out that they had it, they were able to seek out the only specialist that we have, which I should maybe mention now. I'm from South Africa, but I'm living in Sweden. So that's also very different for the disease that we have. In South Africa, there was no treatment and there was not really a lot of awareness about it. Diagnosis is very low. So my my mom was finally able to kind of seek out the only specialist there and receive an official diagnosis, which is also really important for treatment of, I'm sure, most diseases. Um, and yeah, it changed their life. They realized that they could seek out help for what was happening to them instead of just kind of grinning through the pain
Yeah.
and trying to wait for it to go away, because no one knew what was happening to them. And I think more so it had a mental effect. They felt way more empowered and felt like, okay, I'm not going crazy. Like this is something serious, and I'm kind of finally recognized for it. And it gave them a lot of confidence with my sister and I, knowing what it is, knowing how to manage it, knowing that
Mhm.
you can seek out help for it. So yeah, it changed our lives completely.
Oh yeah, Jasmine. What about you? With your mom and dad, did it change? Which, and of course, you were a baby, but I'm sure just from conversations, did they speak about any changes in how they approached healthcare um, and how they received healthcare now that they had this piece of information?
I think for my mom, I think it made her more aware. She was a young mother. She was 16. So, at that age, you think you're invincible in a
Mm,
sense. And then she has this beautiful baby girl, and she's diagnosed with this, and her world is crashing down. She literally had to go from ground up and learn about this because not a lot of people were talking about it, and not a lot of people had it. And I lived in a small town, and she was young. So I'm sure she wasn't trying to go out and just tell everybody about her baby because
right,
of the stigma back then.
right,
But
right.
I think also with my mom, it made it to where when she did get pregnant with my younger brother 13 years later, she made sure that he didn't have the disease, and he did have the trait, and me and her both educate him on that. He is 19 right now. So we both try to educate him on, making sure your spouse or the person that you're with doesn't have the trait like you. And if they do, maybe going around, and if y'all want kids, doing other things differently. In the last couple years, I think that my mom, it has made it to where um, she has also started, even with the trait, sometimes you can also experience pain, like
Mm,
you are a full blown, have the full blown disease. But lately, she does experience pain now. And it's different because she's not used to that. So she has to be like, is this what it feels like? And maybe it's just arthritis or something like that. But the way she describes it, I'm like, no, that's definitely, it's on a lower scale
yeah.
than mine, but
Hmm.
it has started making it coming out within the last couple years, I would say.
Yeah.
So she has had to talk with her doctor about that, and talk with her doctor about she has other genetic things that she has gotten from my granddad, like high cholesterol, and she has become diabetic and things like that. And so things of that nature, she has had to really focus and be like,
Mhm.
okay, is this normal? I need to talk to my doctor about this. This doesn't seem right. I do have this underlying condition, so I do need to make sure that it's not coming from that place.
Mhm.
So I think
Mhm.
it has it's helped her to know my illness, and she has made sure she made healthy life choices ever since. But I think, in a sense, when you're just pre-exposing to something, most likely you're gonna see some signs of it as you age or something like that.
Yeah.
So,
Yeah. Yeah. And I think, I think you raise a critical point. How now she can, kind of question, is this a symptom of the sickle cell trait versus arthritis? Like, I think that's a really practical example of how easy it is to, consider one thing over another, especially if, like, just imagine if she never had the sickle cell trait diagnosis. It's easy, I think, to assume that you know, my pain is coming from another source because I don't know that I even have this trait to be giving me symptoms, to navigate. And so I think that's really critical. And I think it speaks to the importance of having these conversations because it does open up the opportunity to explore all the different possibilities
mhm.
of what we may be fighting within our bodies. And I think that's so important. Hannah, you and I talked. I'm still watching the clock, Jasmine. You just we talked beforehand, and I know you got something else, but stay as long as you can.
I am. I'm just waiting on the call, and then if they call me on
Right,
time, oh well.
right,
If not,
um,
I mean, if they don't call me on time, oh well.
right. You just keep hanging out with us.
I will.
Hannah, I know you and I talked when we had our very first conversation when we met for the first time. We talked about just the importance of communication and having these conversations. And I know we talked about in the groups that you work with, how important it is to kind of keep the conversation at the forefront, to remove any stigma or taboo or um, fear, anything that may present a barrier or a challenge in people wanting to know more about their disease, know more about their symptoms. We just talked about the importance of communication and normalizing the conversations. Um, why do you think it's so difficult to have these conversations within our families, but also, within our communities and with our friends? And I do want to highlight real quickly, Jasmine, you raised an important nugget that I wanted to highlight when you said, your mom not wanting to just go out talking about, I just learned that I have this, and we just learned that our new baby has this. I, I think we do that to shelter ourselves, our mental health, the response that we may get from people. I mean, I think too that there's a sense of privacy, obviously. You just don't go out sharing your business. But I do think a lot of it is because of the concern of how other people may respond. And so, Hannah, I would love for you to just let's talk about, why do you think it's so hard for people to have these conversations with people that they trust or otherwise?
Yeah, well, first I want to mention something very similar to what Jasmine said is in our community, a lot of the time before diagnosis, um, either before diagnosis or even when someone has been diagnosed, because it's a rare disease, a lot of healthcare professionals don't really believe your symptoms are due to this condition. There's not that much research out there that's publicly known. And a lot of the time, a common thing is that patients who have abdominal swelling, so swelling internally in the abdomen, they often get diagnosed with appendicitis and get rushed in to have their appendix removed when there's nothing wrong with their appendix. And oftentimes, the surgery of removing the appendix itself is a trigger for the condition. So there's this loop of kind of miscommunication that leads to worsening symptoms of the disease.
Mhm,
And I think that's our biggest motivator in the community to speak about these things and to get awareness and knowledge to as many corners of the world and communities that we can.
mhm,
Because, like Jasmine said, even speaking within your family helps a lot about, oh, I have this pain here. I don't know if this is normal. Just being able to have someone in your family say, yeah, I get that too. Don't worry, that sounds
mhm,
familiar, is such a huge relief and it can really put your mind at ease. But sometimes that's important to share with communities because sometimes families are not that open with each other. Some people don't know their families. In our community too, people with hereditary angioedema, HAE, can be spontaneous genetic mutations, so they could be the first in their family to have it. So I think it's so great that so many communities are realizing the importance of communication and helping people out. But with your question, Sarita, I think that people find it difficult for so many reasons. I think we found in our patient organization that some people are just introverted. It can be just a personality thing that some communities or beliefs have a stigma about specific diseases or sharing information about it. There might just be a fear within your community that you're not going to be accepted or you're going to be looked at differently. We find with some working professionals that they fear speaking about it because they think it'll affect their work opportunities, that it might affect their relationship with some people and meeting friends. Yeah, so I think it all depends. And I think sometimes people also don't want to speak about it. They don't want to acknowledge it, and it triggers them more emotionally to
Yeah.
speak about this. So I think there's so many different reasons, but that's why I think for the people who do want to speak out about it, it's for those people who don't, and it supports them in a way that they don't have to speak if they don't want to. And that's why I've really enjoyed this work is being able to speak for those who don't want to, so that they don't have to.
Yeah.
That there is information out there, and there are communities out there who can spread the information for them and still support their cause, or their healthcare, or whatever it might be. Um,
Yeah. Yeah. And
but yeah, I
I
wanted to
think,
maybe shoot the question back to Jasmine and ask, how does your family kind of communicate just when they're feeling low or down, and how do you support each other when you're all kind of having something to look out for yourselves? How do you decide to communicate that when you need help from each other?
Well, with my family, we are very big and we are also very close. So it's always somebody gossiping and telling somebody else business that they wasn't supposed to tell.
Yeah.
right.
And that's gonna get back around, and in a sense it is coming out of love, because they are scared and they want somebody else to know, and they want to make sure they check on them too.
Mhm.
And in a while it just be like common knowledge about this person. But also when somebody is sick in our family, we also make it a duty. My grandma is one of those people that will call everybody in the family and be like, this person is sick, this person is in the hospital, this person not feeling well. Put them on your sick list at church, and
Yeah.
doing all that. But in a sense, it keeps us in the loop with everybody else and
Mhm.
what everybody else is going through, and being diagnosed with things that are new, like glaucoma is new to our family. We had one family member that had it, but other than that one family member, and after that one family member died, we didn't know anybody else in the family that had glaucoma. And then we start getting more and more people saying, "Oh, I went to the eye doctor and they said that I got glaucoma," and things like that. So a little bit of gossiping, but a little bit of
Right.
love and just sharing.
Right.
And
Right. Right.
um, also, also with us being together a lot, we can see like, okay, you're not doing good. What's going on? Or just calling them and being like, now, I know you said you were feeling okay, but it didn't seem like it, because it's
Hmm.
been plenty of times when I said I feel okay, which most of the time I will do, because 99% of the time I'm already hurting.
Mhm.
But it's a natural instinct where you don't want to make somebody else
Hmm.
sad and feel bad for you, and make it like you are Debbie Downer in a sense. And I think that's also why sometimes people fear of telling other people that they are sick and what's going on with them, and not realizing that the more that we talk about things, the less taboo things become, and also the
Hmm.
more resources that are out there to help you.
Yeah.
And
Exactly.
Yeah.
not just in a sense of a doctor standpoint, but also a support group that you never knew that you would need or have
Yeah.
in the future.
Yeah. And I think you raise a really good point too. Excuse me. You raise a really good point. I think, when you are the person in it, like for us, it was our son who had the diagnosis, or who has the diagnosis. Um, it that idea of receiving pity from people is real. Is
Yeah,
um even if that's not what it is, sometimes that's what it feels like. Like it feels like people are pitying you, and like, and I get that, Jasmine. Like it's just easier, or like I didn't want to talk about when we received our diagnosis. Kind of to your point, Hannah. Um, I felt like it made it real. Like if I talk about it out loud, then it solidifies what I've been told, and it makes it more concrete. And
Mhm.
I wasn't ready for that. And then I had to get to a place where I shared it. And when I started to open up and share, and mind you, we were still pregnant with our son when we got our diagnosis, or his diagnosis. When I began to share it, it did become easier. I was still protective of who I shared it with. I was still guarded with what I told them, and I was still careful about um, how I shared what it meant. You know what I mean? Because when you start talking about, this is what it is, these are the symptoms, and this is the outcome, the prognosis that I've been given, I think people start responding in a way
Mhm.
based off of that information versus who I am as an individual. And that makes sense in my brain, but it may not make sense. And so what I
It
mean
makes
is, I
sense.
think, does it make sense? I
It
think for
makes
me
perfect
it's
sense.
right. Like I think people start treating you based off the information you've given versus you as a person. And so I was just trying to be very, very careful in how I shared it and who I shared it with. Um, and so you both raised really, really good points about why people may not want to talk about it. One thing too, real quick, I wanted to say, Hannah, you talked about uh, the workplace and relationships. You know, we know that discrimination is something that people with disabilities face. And I do believe that people hold in their diagnoses for fear of negative responses or outcomes from their employers, or the moment you start, if you were to have a pain crisis, just the way your employer may respond to that. I've had a lot of friends in the sickle cell space talk about going to the emergency room and being treated like drug seekers because they're in a pain crisis. Like it's really, really real. um a lot of the challenges that make people don't want to talk about it. And so anyways, I'm on a tangent. I just wanted to highlight that it's so many real reasons out there, and I think you're right, Jasmine, we have to talk about it more. um so the community. Oh, go Jasmine, thank you for hanging out.
You're
Thank
welcome.
you.
Thanks,
um
Jasmine. Nice to meet you.
Nice meeting
um
you. Do I need to
I think
do
I think you'll have to probably log off if
Okay.
you have to take your call.
Okay.
You just do
Thank
whatever you
you.
need to do.
Okay.
Okay.
I'll be back.
Okay.
Okay.
um but yeah, I think it's really important to acknowledge that um people are afraid to have these conversations for so many different reasons. And I think it is important, kind of what you were saying, Hannah. I think it is important for us, those of us who are willing to talk about it. I think
Mhm.
it's important for us to do that because um, for those who don't want to talk about it, which is totally fine, you don't have to. You talk about whatever you want to. But for those who don't want to, we want to be able to empower them with resources and information and experiences. So if they are going through something specific, they have something to lean on. And so I think it's really, really,
Exactly.
yeah, I think it's
Yeah.
so important. I know you were talking about when we talked before, you talked about some different things that you guys were doing within your communities, your group community, to empower your patients and the families. I'd love to talk a little bit about that because I think that's what helps people appreciate having conversations. when they feel safe in doing so. And so I'd love for you to share a little bit about, just the work that y'all are doing to try to keep your patients empowered.
Yeah, well, I'm glad that we're having this conversation on the topic of kind of communication around this, because we've just done our regional conference for Europe, Middle East, Africa, and Asia regions in Munich a couple of weeks ago. And this was the first kind of conference. We have conferences every 6 months for each region, so every year for the same region. And in this conference, we implemented some new structures to it, where usually we speak about kind of what the disease is, what medical research has been done, what's been done by researchers in the field, and then with the patients, we speak more about just the big stuff. I think what's been happening in your
Mhm.
region. Is there new medication available? That sort of thing. But I work mostly on an international level now. I work mostly with the youngsters community, which is we group them between the age of 12 to 25. So it's quite a broad range, and that's kind of where we see the disease can be most intense, and you can have flare ups more often around that age because of puberty, higher stress, all of these kind of things, and more physical activity. Yeah, drinking alcohol, all of these sort of things. So it's
Right.
been interesting working with youngsters around the communication space, because they're just learning themselves about their body and how to manage this disease and what triggers them and how to speak about these things amongst all the other social pressure of fitting in at high school, going to
Yeah.
university, starting to
Mhm.
date,
Mhm.
establishing communication with your family and with your parents. So we implemented a new discussion into our conference, which was a panel discussion where we had about 5 of us on stage who were either patients or caregivers of different ages between that range, 12 to 25. And then with the audience, we had about 100 youngsters from different countries. And with the audience, we just had a conversation, just like we're doing now.
Yeah.
It was kind of
Mhm.
inspired off of a podcast type of feel.
Mhm.
Um, where we were just able to speak about the importance of communication. Instead of speaking about all the physical things, this time we spoke,
Yeah.
how do you communicate?
Mm.
How are you able to communicate? Do you know how to explain this to different people in your life? What do you need communicated to you about your disease, about growing up with it? What is most helpful to tell your friends? What are you scared of communicating? So we asked all of
Yeah.
these kind of questions, and we got the most amazing engagement from them. They really responded well and really engaged well, and we're so relieved to speak about more of the everyday kind of things that you
Mhm.
go through, rather than just the
Mhm.
overarching, how does this affect you in terms of symptoms, but how does it affect you in terms of socializing and living your everyday life, and what are your biggest fears, and
Yeah.
what burden does this cause you mentally. And these youngsters responded afterwards saying this is so important for every disease community, they believed, because just hearing each other speak about these different aspects of everyday life that even people without rare diseases have to
Mhm.
navigate.
Mhm.
Um,
Mhm.
they
And I
said it
think let me
really
just,
empowered them. Yeah, sorry.
I no, I was just going to say real quick, I think it's important too because it creates an opportunity for them to give feedback on what they feel like they need versus um, creating something that you think will meet a need that may
Mhm.
not even be there. I think a lot of times in the nonprofit space, um, or in any space, even I think in corporate and in any space, for profit, we always create things, clinical trials, even when it comes to measurable outcomes. I think we're creating things that we think patient communities are looking for, and we're not always asking them what they're looking for so we can create those things. And I think that's commendable. I think it's really great that you took the time to ask them, even though they're young, they're kids in a lot of instances, what do you need? before you actually start developing programming to do that. I just didn't want to lose that thought. Go ahead, sorry.
Yeah. Well, exactly. And on that point, that was exactly why we decided to implement more of these
Mhm.
engaging kind of panel discussion type of things. Because when we encourage the youngsters to share their story, first of all, asking them what has been your biggest learning experience, or what has been your biggest communication challenge, when they start sharing their stories and hearing each other speak in kind of a open discussion style, they become a lot more open to communicating these things and a lot more
Yeah.
open to um, telling us what they need, or how, or helping each other develop a way to speak to their friends about this, or their
Mhm.
new relationship partner about this.
Mhm.
Um, so yeah, it was really helpful implementing something more engaging, not just on the scary, oh, this is what happens to your body side of things, but more,
Yeah.
we're all just we're all just humans trying to get through the best we can, and how do we do that
Yeah.
together with this added thing to think about? Um,
Yeah. Yeah.
yeah,
Yeah.
and I'm
That's
sure,
so important.
and maybe this goes across communities too, is the caregiver aspect. We really try and engage caregivers with the community, because, as you know, for your son, it's just as scary being a caregiver
Yeah.
or a family member dealing with this, especially when you have a child with the
Mhm.
condition. You never want to speak for them, but to a certain extent you have to, and
Right.
you have to be their voice, and
Yeah. Yeah.
you have to know what's going on. So it's kind of up to you to establish that communication early on, and that
Mhm.
can be really challenging. So I think nonprofit organizations and patient communities really embracing family members and caregivers, it helps them so much, because
Yeah.
their world can be just as scary not knowing what's going on with the diagnosed person. Um,
Yeah.
yeah.
Yeah. I think, good for y'all. I think I think it's so important. We don't have I think we have a lot of conversations. Listen, this weather, cold, hot,
Everyone's
it's got
coming
my
down with something.
sinuses. Yeah.
Yeah.
Um I think it's so important to have these conversations. And have the communities who we're speaking to be a part of the conversations, because we want to meet the need. I love how, you said everything is not, this is what's gonna happen with your body, and this is, and just, having that in there because you want them to be aware of that, but also, talking about just that overall quality of life and how to make it great, I think is so important. That was something that we went through too, in terms of, because of the prognosis, it was just a lot of conversation about that. And even from the healthcare space, I felt like we were expected to just be sad and,
Hmm.
and, this is what you're dealing with. You just get those, oh no, oh my God, and I think that within itself is enough to drive you mad. Like you just, like, I needed to open up
Hmm.
so I could block to some degree those responses all the time.
Yeah.
You know, um
And I think what comes with that is this kind of response of people shut down in communicating with
yeah.
you, because they think that you wouldn't want to talk about it, or it's
Yeah, yeah, yeah,
too
yeah.
uncomfortable for them. They don't know what to say, or they don't know how to
Mhm.
deal with it, or what questions to
Mhm.
ask. So
Mhm.
I'm not sure if you got the same, but whenever I do try and speak about it, people often stop the conversation, or say, "Oh, we don't have to talk about it if you don't want to," or "Oh, sorry for bringing
Mhm.
it up," or something.
Yeah.
And I'm always the one who's like, "No, no, no, please ask me more questions. I need to get this
Right.
information out there. Ask me anything you want to know."
Right,
Um,
right, right. And I think that's a great spot to be in, because I'm the same way. Like, no, I mean, if you got a question, let's talk about it. Or if I see someone maybe looking or staring, like I'm not afraid to say, hey, I noticed you looking. Do you have a question? But in the same regard, I think it's also important to acknowledge that every time we connect, we don't have to talk about that. You know what I mean? Like we can talk about, the weather. We can talk
Mhm.
about, if there's a series that we both watch on TV, we can talk about something different too. And I think that's why it's important. Um, I feel like I keep saying the word important, like in
Mhm.
my brain, it's like you just said important again. I think that's why it's so important to normalize the conversations so it doesn't feel like it's so isolated. Like you either talk about this or nothing. Like you just fuse it into a normal conversation, and just like you go from topic to topic when you're talking to people, you can do the same thing about your diagnosis. You don't even have to bring it up if you don't want to. And I think that comes with just normalizing that this is what it is, this is what it does. Um and I'm thinking about youngsters, teenagers. I'm thinking about them, hanging out with each other, with friends. Well, who says you have to talk, you have to bring up the fact that one or two or whatever has some condition or diagnosis. Just
Yeah.
be just be young friends, and be comfortable having conversations if it comes up. But you don't have to force it to come up in everything that you do. And I think that's what I don't know. I think sometimes that's the Debbie Downer. I think that Jasmine was talking about, that feeling of I don't want to be the Debbie Downer. I think
Yeah.
I think that's there because there's this assumption that if I'm around, this is what we got to talk about,
And
and
it's
it's
also
going to dampen the mood. Yeah.
yeah, and I think it also has to do with even not even talking, but activities. I think
Yeah.
like you said with what Jasmine said is a lot of the times I think people are scared to mention that they have something so serious because it might kind of the other person you're speaking to might now have the ability to decide what they think you're capable of or what
Right.
you
Yeah.
should be doing together, and they're not going to invite you
Hmm.
to certain things because they don't think you're capable of that, or you'll be
Right.
too sick,
Right.
or something like that. And that's why I have so much respect and inspiration from rare disease communities or communities of disabilities that are so visible
Hmm.
because you can't decide whether you want to speak about it or not. Whereas
Right.
in my community with HAE, as much as you get external swellings and symptoms, and the pain is very visible, a lot of the
Hmm.
time when you get internal symptoms and a lot of the other symptoms that come along with it, besides the swelling, are internal and are pain related. So a lot of the time people don't know you have anything. And that,
Mm.
of course, comes with a whole nother can of worms
Oh
of
yeah.
communication,
Hmm.
people
Yeah.
not believing that there's anything wrong or
That
thinking
invisible, yeah, that
in
invisible
your mind.
disability.
Yeah,
Yeah, yeah,
exactly.
yeah.
But it's why I really have gained great perspective speaking to people from communities that, like I said, have these very visible disabilities because
Hmm.
they're forced to speak about it and own it and really try and show able people that this does not define me and this does not define my capabilities. And it kind of
Hmm.
forces people to realize you are just normal people that want to chat about normal
Right,
things.
right,
And
right, right.
fearing what someone else has or this disease or because they're different is not going to help that community. They're not scared of it
Yeah,
themselves. It's more you that is scared of them
right. Oh
than
yeah.
us that is scared of anything.
I
So
listen, I say that all the time. Like that is one of my 1,000 mantras. Like I always say, for people in the disability space, it's not them that struggle with building community and relationships and making friendships. It's the other person
mhm,
because they don't know how to respond or they don't know how to act, or it's literally exactly what you just said. They determine the person with disabilities capacity. They determine what they are able to do or not do, and they just don't give us the chance to be a part. And I think that's why buzzword for today is so important. I think that's why it's so important that we are in spaces that we might not otherwise be in. So people will learn how to interact with people with visible and invisible disabilities. Because I think you're right. When it's not on the surface and you can't see it, I think there is this underlying judgment of, nothing, because I don't see it, there must not be something there. And that's not always the case. There are some underlying um, symptoms and conditions and severities that come with invisible disabilities. And I think we do too much judging and assuming when we should be listening and observing. And so, yeah, that's a whole word right there.
Yeah. And just like we said, that kind of that's true for within the community and
Hmm.
between the community and people who don't have the disease, because I think
Hmm.
communicating your needs and what you're feeling and what you're capable of is really important for between you and your medical professional, you and your family, you and your friends who have the disease, and you and your friends who don't, because being able to really control the
Hmm.
conversation about what you
Hmm.
are able to do, what you want to do, is
Hmm.
so important. So
Hmm.
important. Yeah,
Buzzword.
is the word. Yeah,
Hmm.
yeah. And I know that, like I said, just being able to be a caregiver that asks a question, like
Yeah.
that's sometimes all it takes is asking the person a question instead of
Yeah.
answering it in your head for them, and not being
Yeah.
scared to ask what you think might be a taboo question or
Yeah.
insensitive or something. It's often us in the rare disease community that have the thickest skin and don't take things
Right.
so personally anyway. So
Exactly.
yeah,
Exactly. And literally that's the mic drop.
yeah,
Is just don't assume. Don't answer your own question. Give the person the opportunity to respond for themselves. Like that's it in a nutshell. Um, that's it in a nutshell. Well, I appreciate you so much, Hannah, for being a part of this conversation. I hope that our listeners take away that knowing your family history is a conversation that we shouldn't shy away from, and really knowing your family history, knowing yourself and your symptoms, your condition, building relationships with other people. It's it's really about communication. It's really about having conversations um, at the degree you want to do it,
hmm
at the comfort level you want to be at. There's no right or wrong way, but the key is to have those conversations, and don't be afraid to ask for things that you need. Don't be afraid to get understanding. Don't be afraid to let a person respond for themselves. Like those are really, that's the theme that I picked up from today's conversation.
yeah.
So as we wrap up, any last words for our listening audience?
Well, I think, like you said, you don't have to be as you. I mean, you can be as engaged as you want to be, but
Hmm.
I think that that's why I love communities like ours that are willing to speak
Hmm.
about it on different platforms, because it
Yeah.
enables people who want to be engaged and want to know their family history and be safe and have control over their own disease, but not communicate about it. So it's kind of
Yeah.
communicating in a different way. And I
Yeah.
think that's what I try to speak to the youngsters in our community about a lot is, if you are shy about it, if you're confused and you don't want to shout and scream about having this scary disease or
Hmm.
something that you're battling with yourself, you don't necessarily have to, but
Yeah.
still try and be engaged, because it could help others, it could help you, or
Yeah.
it could just lead you to a really great, awesome community that you have friends around the world and you have people who
Hmm.
understand you. So I always just encourage the youngsters and any other patient of any rare disease or disability or condition, just reach out to these resources, because I know that it's changed my life and my
Yeah.
perspective on community. And yeah, it doesn't even have to be within your own disease community. Like, we're speaking across
Right.
different experiences that are so related. Um, so yeah, my ending words are definitely just be engaged for your own sake,
Yeah.
even if you don't want to speak about it yourself. Just look for the
Right.
resources out there, and find your community. I think there's nothing more important than anything than community, especially when you're dealing with something like this.
Yeah, that's awesome. Really, really great takeaway. Well, all right, guys, I want to thank you for tuning in to another episode of the Being Rare podcast. As always, if you have not yet subscribed, what are you waiting on? Go ahead and hit that subscribe and follow button. You can find Being Rare on any platform where you stream your podcast. You can also find us on YouTube. You can also find Sarita Edwards on all social media platforms, Being Rare on LinkedIn. No, I'm sorry, Being Rare on Facebook and Instagram. You can also follow The Real Edwards. I will put information for Hana in the description of this episode, and you are more than welcome to reach out to her. I'm so glad to have connected with you, Hana, and excited to have you and Jasmine on today's episode. All right, that's it. Until the next episode, be rare. Thanks, Hana, for joining.
Thanks, Sarita. Bye.
Awesome. Bye.